Welcome to the Passion for Patients podcast. I'm Tonya Winders, the president and CEO of GAAPP, the Global Allergy and Airways Patient Platform. And I'm so glad that you've joined me here as we take a quick look back at all of the wonderful achievements of 2025 and a quick look forward to what is on tap for 2026. So today I will be the only one on the podcast, and I thought it was important as we come to the close of another year to really stop and reflect on all that we've achieved as a community together. At GAAPP, as you know, we are now 200 patient advocacy groups across the world in respiratory and immunology. This is a major milestone in just the membership growth of GAAPP. Fortunately, we have members that span every single continent and cover more than 25 different disease areas. Now, over the course of 2025, we have continued to advance each of our 4 pillars. And so I want to take a moment and reflect on the awareness achievements, the education accomplishments and projects, as well as advocacy advancements and key research numbers. So first, let's take a look at awareness. Over the last year, we've participated in 25 World Awareness Days, and we've averaged more than 60 patient advocacy organizations participating in each and every day or month or week. And this is all because you see the importance of driving disease awareness day in, day out. And so whether it is a new condition like chronic cough, where we had over 75 patient orgs participate, or a very old, well-established day like World Asthma Day, where again, we had over 70 patient advocacy groups participate, it's important that we speak up with a very common voice, with very consistent key messages each and every awareness day, week, or month. So thank you for all of your efforts in driving disease awareness throughout 2025. We also had a very successful GAAPP Summit with over 180 people coming together to celebrate and to plan for the year ahead at the GAAPP Summit. And so we look forward to sharing some of the highlights as well as some of the plans for the new year in just a moment. In the education pillar, it was about several key large projects that we were able to achieve together. We had a number of new hubs. For most of you, you're familiar or aware of our Knowledge Hub, which is our member-only space that is designed specifically for you as GAAPP member organizations to connect, collaborate, and to advance your capacity to learn more about how to be a more effective, efficient patient advocate in all the great work that you're doing across your mission, across your country. We also had our Understanding Your Medications Hub, which takes a look at every single disease state that we cover and also emphasizes the various different types of medications that patients are often prescribed. So helping our community to better understand and navigate their conditions and their medications in order to have better outcomes long term. In our education mission area, we also did a great deal of capacity building over 2025. We held a number of GAAPP academies on various topics like fundraising and volunteer and dealing with HTAs. So many different topics that, again, help you to support your staff, your team, and doing your job each and every day. We also had the opportunity to engage in our success programs and in our regional alliances through our education pillar. And so through all of this work, it's you coming together and connecting with like-minded, passionate patient advocates from all over the world to truly drive evidence-based approaches in disease management. So thank you to how you've engaged with our awareness and education pillars throughout 2025. Now, you've heard me speak about this throughout 2025, about the milestone year it's been in advancing public policy and advocacy work. As you know, in May, we had the landmark resolutions in lung health, skin health, and rare disease at the World Health Assembly 78. And I am excited to report to you that we also just had the non-communicable disease United Nations high-level meeting resolution declaration pass yesterday. So as you know, this was introduced in September, but unfortunately had to be deferred to a full United Nations vote. And that vote just happened on December 15th. So we are excited to report that for the first time ever, we have both a United Nations political declaration elevating respiratory disease and a World Health Assembly resolution elevating respiratory disease. 2025 is a year that I will never forget because it is the year in which globally chronic respiratory diseases like asthma, COPD, and pulmonary hypertension were elevated and fully recognized as the public health priorities that they should be. So thank you for advocating with your country, with your government, and now the real work begins on the implementation of these important documents. So we'll talk more about that in our 2026 plans. We also held a couple of advocacy summits where you were able to connect with like-minded individuals and set your 2030 strategic priorities and roadmaps to achieving policy change in all the different disease areas that you work in. And GAAPP is here and so excited to support you as we move throughout 2026 in that first year of implementation. Now, in our advocacy pillar, we also had a most successful Speak Up for COPD coalition and campaign for 2025, where we had record-breaking numbers of participation across all social channels and across our first ever social chats. So in every single time zone throughout the world on World COPD Day, you guys came together and spoke up for the millions and millions who are living with this condition, but who may not have the ability to speak up for themselves. So thank you for that as well. Now, in our research mission pillar, we really had, again, just a very important year in ensuring that the patient voice was heard throughout all research and development in our space of respiratory and immunology. We conducted a number of surveys across over a dozen different countries and had those surveys published in peer-reviewed journals. Together, we had over 30 peer-reviewed publications of advancing the patient voice in respiratory and immunology in 2025 alone. We presented at more than 15 congresses and presentations with abstracts, posters, and symposiums. And we had the opportunity to participate in a number of different recruitment efforts for clinical trials to advance innovation in the space of respiratory and immunology. And we could not do this without you understanding the importance of each and every pillar of advancing the work of driving disease awareness, of also ensuring guidelines-based, evidence-based education to patients, caregivers, and healthcare professionals, as well as ensuring policymakers and both government and regulatory officials understand why we have to create a landscape where we can get the right treatment to the right person at the right time with the fewest barriers. And this is only done through good data generation and evidence building. And that is what all of our work is really built upon. And so you as our community, I just had to take a moment here at the end of the year to give a hearty thank you, especially to the staff and the leadership, to our industry partners who have funded this work and have helped us to advance the growth of GAAPP, the influence of GAAPP, but especially to you as the member organizations. You are the heartbeat of everything we do. And I truly just wanted to have a moment in time where we could reflect and give you the appropriate congratulations and thanks as we go into the holiday season. Now, I don't know about you, but I am going to take a good solid 2 weeks and probably hibernate here over the end of December. And I'm doing that so that I can rest, reflect, celebrate alongside family and friends, but also recharge because 2026 is going to be yet another year of opportunity for those of us that are working in this space of respiratory and immunology. When I look across the 4 pillars, there are many things that are knocking at our door in the new year. First, in the area of disease awareness, we have opportunities once again to coordinate efforts across all of the different awareness days and to come together for regional alliance meetings in each of the WHO regions throughout the world. So we've already marked the calendars, and you'll be getting communications from the GAAPP leadership team about when to look out for your invitations and for your registrations for all of these special events. We'll come together in your region as well as at the annual GAAPP Summit in September 2026. So mark your calendars. September 3rd and 4th are the dates when once again we'll gather together this year in Barcelona. Now, in the education mission area for 2026, we do have several guidelines updates that will be forthcoming. And so we need to be involved in those things. We also have opportunities to educate on things like COPD exacerbations with our exacerbations hub that was launched here at the end of the year, and to continue to educate on the innovative treatments as well as risk stratification of populations like asthma and COPD and pulmonary hypertension. There are so many novel, innovative treatments on the horizon, and I expect that we will see new approvals in atopic dermatitis, in chronic urticaria, in severe asthma, and in COPD, as well as pulmonary hypertension in 2026. So the space is very robust. And I think that we will actually get an approval as well in perennial allergic rhinitis, a space that has not had innovation in really quite a long time. And so to have new innovative approaches to managing uncontrolled symptoms in all these conditions is, I think, such an exciting opportunity for us as patient advocates. We can offer hope to people that have been living frustrated lives with unresolved symptoms for years and years and years. So stay tuned for all of the exciting developments on the pipelines that are forthcoming in our space of respiratory and immunology. In advocacy, it truly is going to be all about implementation at the national and regional level of the work that we started in 2025 on the global resolutions and political declaration. So we'll be prioritizing about 24 countries and working alongside you, our local GAAPP members, to meet with government officials, to meet with media, and to get that implementation of these resolutions and declarations pulled through into national plans that will truly make a difference. We have our key targets. We know what end is in sight for 2030. And so now we need to take those first steps in 2026 and beyond to reach those goals. Finally, in the research mission area, I do expect that we'll see a number of new survey and data generation opportunities, as well as continued work with the comprehensive Airways assessment tool, the COPD exacerbation recognition tool, our AirQ tool, and our other shared decision-making tools. These are all vital to have patient-reported outcomes and patient-reported experience measures that are meaningful to those of us living with these conditions. So stay tuned to all of the exciting developments in awareness, education, advocacy, and research as we turn the calendar to 2026. Now, as I close, I do hope that you will take that time to step back from your day-to-day activity, that you will celebrate all the wonderful achievements that we achieved together, that we accomplished throughout 2025, but that you will rest and recharge for all that is on tap for the new year. I know together we can continue to reach new heights of success for each of our individual organizations and for the collective family that we call GAAPP, the Global Allergy and Airways Patient Platform. So, on behalf of the team at GAAPP, we hope that you have a very happy holiday season, and we look forward to supporting your efforts in 2026. And until the next time, stay passionate.